Thank you, Stravani. So oral cancer can be deadly. How a simple trip to the dentist could save your life. When we come back. When you go to the dentist, don't just ask about your teeth. It's important for your dentist to check for signs of oral cancer and other things. Just under 45,000 people in the United States will be newly diagnosed with oral cancer this year. That's about 118 new cases every day, which means someone dies from oral cancer in the United States every hour of every day. Pretty frightening statistics, and something that we'd like to talk about with this woman right here. She is Dr. Anna Berik. She is the owner of Newton Dental Associates. Thank you so much for coming in. We really appreciate it. And this is something that you're passionate about, and you say every dentist should be checking for oral cancer.
We are the front line. We have patients coming in all the time. We're there, we're in your mouth. We are the best ones to inspect. It's so easy to build it in as a part of your regular routine exam.
And you're saying some don't do it at all.
I was shocked to find the statistic that out of patients that go to the dentist, regular patients, only 15% in the U.S. receive oral cancer screenings.
And you said they're easy to do.
They're not only are they easy for the doctor to do, they're easy for the patient. They're non-invasive. They're very often free.
And the things that you can find and that you can catch save people's lives.
Finding things early is pivotal in saving lives. Like any cancer, there's no difference in oral cancer from any other cancer. You know, the earlier it's diagnosed, the higher the survival rate. The 5-year survival rate is incredible.
No, it is. And let's talk about, it's not just oral cancer. It's a lot. You dentists find a lot with a simple visit, or they can, correct?
Correct. You know, the mouth, the tissue in the mouth turns over so quickly that there are so many other types of disorders and diseases. We can tell iron anemia. We can look at uncontrolled diabetes. You know, there are so many other things. You know, the overall health of the person very often manifested in the mouth first.
And that's amazing, because you don't even think that that's what it is, but really dentists can tell us a lot about our health and where we're at. That's true?
It's absolutely true. You know, there are in the early days of HIV patients, these were the first lesions that people were finding. Right. You know, and so can you imagine how valuable that is to intervene so early?
No, absolutely. It definitely is. So in terms of oral cancers, what do you see in your practice? I mean, in terms of what you do and how you approach this. So if you see something, then what happens? What's the next step?
So at Newton Dental, at my practice, we use our hygiene visits as our opportunity. So our hygienists who spend 45 minutes to an hour with every patient, and then the doctor will come back in. And so twice a year, we are doing oral cancer screening on all of our patients. So it's often scary if you find something. So one of the main differentiators in what you're looking at in terms of a lesion is it there for 14 days unchanged? It's a 2-week. So if you find a lesion that someone was not aware of, there's no pain, you know, you'll alert the patient. Did you know this? Do you have a pizza burn? Good questioning, you know, good questioning. You don't want to frighten people. And then there's always a 2-week follow-up. There's a 2-week follow-up, and you're going to go back and you're going to revisit the lesion. Oftentimes I take photographs. You know, that's very helpful. And then at 2 weeks, if you see no changes in that lesion, you're going to refer. Because, again, early detection. Right. Early detection, early detection.
That's really everything, isn't it? So your advice to anybody watching this, and we're talking about this because April is
Oral Cancer Awareness Month.
So your advice to anybody?
My advice to anyone is that you should be visiting your dentist, and you should be having oral cancer screenings at your dentist. Ask for it. You know, the best patient is an educated patient. You know, I think dentists don't tout what they're doing. You know you'll have an oral cancer screening. Your dentist will place a piece of gauze on your tongue and pull it out to look at the left and the right. Their hands will be in your mouth, feeling the floor of it. You're feeling for lumps and bumps. You're looking around at all the little hard places to see.
No, you're right. That's great advice. Dr. Anna Berik, owner of Newton Dental Associates, thank you so much for coming in. We're with great advice. We really appreciate it.
Thank you for having me.
Thank you very much. Off to you.
Thank you both.